Good afternoon. Thank you for joining us for the daily update about the Riley County COVID-19 response. My name is Vivian Uccello. I'm the Public Information Officer for the City of Manhattan and serving as the lead Public Information Officer for the Riley County Emergency Operations Center. Today we'll hear a brief statement from local Health Officer Julie Gibbs, and then we'll have some time for questions and answers. Thank you. Julie?
Hi everyone. As of today, March 31st, Kansas has 428 positives statewide, with 9 deaths and 79 hospitalizations. 39 counties have been affected. Riley County now has 4 positives. The most recent we learned about just a few hours ago. One individual is a 57-year-old male who had recently traveled to a church function in Kansas City on the weekend of the 19th, returned home on the 20th, and developed symptoms that next day. He stayed home throughout the week, and when symptoms worsened, made a trip to the ER. He was tested on the 27th. His family is showing no symptoms and are isolated at home. He is currently in isolation at Via Christi Hospital. We have been in contact with his family and those that he has been in contact with. The most recent individual who tested positive is a 29-year-old male who presented at KSTAT on the 22nd. We are currently in the process of finding out more information on this individual. Currently in Riley County, we are monitoring 23 people, and we still have 10 tests pending. This number includes tests pending in Fort Riley. We have had a total of 50 negative tests so far in the county. For weeks now, we have been telling people the same message: stay at home unless you're needing something essential. While we can all agree that sunlight and fresh air are essential for both physical and mental health, we want to be very clear in our message about this. If you go outside, please don't congregate in groups. This is not the time to play with friends, have neighborhood get-togethers, and certainly not the time to play on playground equipment. We really need to take this order seriously to reduce our risk of exposure as much as we can. Your actions have a direct effect on others. I mentioned it yesterday, and I'll say it again. The days ahead will be long, but the more we can keep our distance from others and stay at home, the less time we will have to be in this situation. Please continue to only share valid, reliable information. We have many sources for you to choose from, including our Facebook page, the Riley County Health Department website, the KDHE website, and of course, the CDC website. If you have questions, please email us at rileycountycovid19@gmail.com. Again, that's rileycountycovid19@gmail.com. If you are experiencing symptoms such as fever, cough, or shortness of breath, please call the screening line at 785-323-6400. We have healthcare professionals that manage that line and are there to help guide you in the right direction. They will be available every day, 8 a.m. until 10 p.m. Again, that number is 785-323-6400. We have so many people that are willing to help and to donate. If you would like to donate non-food donations, please call 785-537-3113. Again, that's 785-537-3113. If you would like to donate medical supplies like N95 masks, please call 785-587-5462. Again, that's 785-587-5462. Thank you so much for your support and cooperation during this time. Hang in there just a little while longer. We will get through this together. We'll now take any questions you might have.
I have one question on my Facebook Live, which is someone is wondering why we're leaving hotels open at this time when you're asking everyone to stay home.
Sure. So the question was, why are we leaving hotels open at this time when we're asking everyone to stay home? According to the governor's order that was issued on Saturday, put into effect on Monday, that is considered one of the essentials, so they are exempt from the order. And if you have any further questions about this, you can always email us at rileycountycovid@gmail.com.
We've been getting some reports of some scams that local residents are seeing. Maybe Officer Muldrop, can you speak to that?
Yes, hi. Kurt Muldrop, Assistant Director with the Riley County Police Department. And the question was about scams that we're starting to hear about. And as always, scams are a potential problem. Don't give out your information over the phone or to anyone asking personal information. Just don't give it out. I'd also like to address the potential for door-to-door salesmen. They have been deemed not essential. So if you get anyone coming to your doors attempting to sell anything, which is another good way to avoid the scams related to this, refuse to speak with them. The city is not giving out permits for door-to-door salesmen, so we shouldn't be having any. That's not an essential function.
This question from my Facebook Live says, they've noticed some restaurants are serving food but are not wearing gloves. Who would be the person to contact if someone's wanting to report something like that?
I think in that type of situation, the question is about folks are seeing restaurants that are serving food without gloves. Simply put, there's not a specific rule for us with that. Obviously, we want people to practice good business practices, but you can go ahead and contact the hotline for that information, and we can forward it to the health department to make a decision on how we'll handle those.
I have a couple of medical questions that might be best for Dr. Chase. This question is about the onset of symptoms. About how much time, or is there an average from when someone is exposed to when they start showing symptoms?
Yes, my name is Segen Chase, and I'm an internal medicine physician at Centerpoint Physicians here in town, and I'm serving on the MHK Clinical Task Force that works in connection with the county, the hospitals that are local here to make sure we have a robust medical response. The question was duration of and timing of symptoms with this virus. We're still learning a lot about the virus. One of the things we do know, typically people start to show symptoms around day 5. That would be fever, cough, shortness of breath. Many times we're seeing the respiratory component really ramp up around day 8 to 10, and their symptoms can change quite rapidly. We're seeing courses for patients that are significant and severe enough to be hospitalized that are quite a bit longer than normal hospital courses for pneumonia, and they can be in the 2 to 3 week stage.
Can you also talk about if someone does have symptoms and maybe a milder case, if they're treating at home for themselves or their family members, what's some medical advice for those cases?
Sure. The question is regarding patients that might be infected with mild or moderate symptoms and not be hospitalized, and how they might approach this, being a patient at home, and how their family might approach this. I think it's really important that we remember that 80% of these people will likely not need hospitalization, and so it will be in this mild to moderate case, which is what we're typically seeing. And again, data is changing all the time with this virus since it is a novel virus. One of the things I think it's important is to keep close contact with your provider. We have noticed longer turnaround times for tests that we would like. I recognize this is frustrating for people. It is just as frustrating as providers to make sure we're providing you accurate information as soon as possible. If you have been tested for the COVID virus, you should be in isolation at your home. You should not be going to the grocery store. You should not be going to the gas station. You should be at home and minimizing exposure for others. It's important if you do have family members around that they are continuing to use good hand hygiene, that they are wearing masks and gloves if possible, that you are minimizing exposure with these family members as much as possible so we can try to prevent spread, but knowing that obviously they are also around you and you have the potential to be infected. That's why we've tested you, and so it's important that they also treat themselves in isolation. Please request friends or neighbors to get anything from the pharmacy or grocery that you may need, or do the delivery options that we do have. we live in an age where we are really very lucky to have something like that, so you don't have to get out and expose others. I think it's also important in these cases that we're remembering to take good care of yourself if you are home and ill, or if you are a caregiver, making sure you're staying hydrated, as rested as possible, eating regular healthy meals in order to improve your getting well and to minimize getting sick if you're one of those caregivers. We often underestimate the rest and hydration. We can't give that as in a pill, so I think it's really important.
One more medical question and then I'll move on. At what point is someone considered recovered if they have fallen ill with the virus?
The question is about recovery, and I think this is really challenging. You'll see lots of different things. I know a couple weeks ago they had interviewed someone from one of the cruise lines that was at the University of Nebraska, and they were wanting 3 negative tests. We are not routinely testing people for the virus to make sure they're negative. We clearly have a shortage of tests, and that's been a challenge, and so we're just not able to afford that luxury right now. I think respiratory symptoms improving and fever going away, I would give at least 72 hours without a fever. We know that there's a potential for this virus to linger a while. I don't know that there's a perfect answer to that question at this point in time with the amount of medical information we have, but I would definitely want respiratory symptoms to be improving and have been improving for several days, and fever to have not been present for at least 72 hours.
Thank you. My question kind of piggybacks on what you just said, and that is with the lack of tests, there are quite a few members of the community who have mentioned that they may have had symptoms or know someone who has, and they have been denied a test. Can you elaborate on that, or is that something someone else should answer?
I can give some answer. The question is, some people in the community have mentioned that they think they possibly should have been tested for COVID-19, that they had heard from media reports that there is a test for everyone, but then to hear on the flip side that there are shortages of tests. Right now, in our state, in our community, we have been limited in our ability to test. KDHE has put out guidelines that have varied from the start of this and have changed over the course of time based on the number of tests, and it's mainly narrowed from larger to smaller in terms of we're trying to focus our efforts on people that are maybe older, have chronic comorbid conditions that would affect how the virus affected them. Also healthcare workers, if that's someone that's going to be around other patients and we don't want them around, we want to know if they have a positive. And that's changing day to day based on what our availability is. And I think there's also, we want to make sure that when this started, we still had a lot of influenza and also other respiratory viruses that were in the community and still are present. And so we want to make sure that we're using those tests judiciously. And I might defer some of that to Julie as well about availability of testing.
And this next question, you can follow up with that, and then I have another question for Julie.
Sure. Well, I think she covered it very well. We're watching our availability right now. That's why we have these teams that we work with, and we're keeping track of not only that, but all of our PPE and making sure that we're all keeping that in check, and that we have avenues to work with to get more.
Several people are asking for personal information about people who've tested positive. Will you just clarify about what we will and will not release regarding patients and their care?
Sure. Regarding patients and their care, we cannot release any personal information to protect that patient. What I've given you is what we can give out. We can give out more details as far as where they've been. So that will be coming. But please know that we take these investigations seriously. We do follow up with the patient and their family and anyone that they've been in contact with, and that's currently going on now.
Can you talk a little bit about timeline for those notifications, and are more staff coming on board to help make that flow go faster?
Yes, so the question is about timeline, and are we seeking more staff to make that go quicker? And yes, that's actually being done right now. We have health department staff working on that, as well as RCPD and other members of EOC are helping with contact tracing.
And then a question regarding contact tracing and community spread at this point. Is there any indication that either of the last two is a community spread case?
The question is there any evidence of community spread? And as of right now, no, there is no evidence, and we'll continue to make our contacts.
I have a question questions about businesses that are open and closed and possibly Officer Muldrop. Can you talk a little bit about the difference between a business being open to the public versus open for employees to do work, and what are some guidelines associated with that?
The question is about businesses being, the difference between businesses being open and open to the public, as well as open for employees to do work in there, and then the guidelines. The general answer for businesses on whether they should be open is to refer to the governor's order, and there's Kansas Essential Functions that you can look at and determine whether your business falls under that exemption. We're saying that if you don't obviously fall under that exception, you should consider yourself closed. The governor, within that order, also details that your doors should be closed if you're not with that exemption. Your doors should be closed to the public. You can have employee or employees inside that have to maintain some of the business functions, possibly even handling online orders such as that, but the door should be open to the public. We want everyone to understand we're trying to keep the public from going out.
Did you mean the doors should not be open to the public?
Yes, if I said doors they should be closed to the public, because the goal is to reduce the amount of need for the public to go out and about. Again, we want to drive home the stay at home. We want those circles of influence, the circle that you're involved with, to be reduced, so that if someone is exposed, you reduce the potential for the number of people exposed, and you reduce your risk of being exposed.
Are there guidelines employers have to follow to keep their employees safe?
We've, again, put out, the RCPD has gone around, and we have more of the paperwork that will help you understand best business practices. And yes, there are guidelines that we are asking businesses to follow to keep them safe, such as limiting the number, keeping the social, what we're probably going to start saying, social separation of that 6-foot distance, having hand sanitizer available for people, as well as sanitizing your work location.
And then I have a question regarding, on my Facebook, someone has asked, what about contractors that have been working on Fort Riley, if they're concerned about them continuing work, who do they need to contact for that information?
I assume that's meaning construction contractors. I don't know, but construction contractors are part of the essential functions that are exempt.
Are any restaurants allowed to serve dine-in at this point?
No restaurant, are any restaurants allowed to serve dine-in is the question. No restaurants are allowed to serve dine-in. Takeout, carry-out, and delivery are the only ability for restaurants to be functioning.
Okay, this next question is for Dr. Chase. We've had some questions about wearing masks and the effectiveness. Is there a recommendation for the general public about the wearing of masks?
The question is about the wearing of masks for the general public. I think in general, if you are immunocompromised and know that you are in a situation that this virus could be very lethal to you, I think it's important that you stay at home as much as possible and minimize any outside contact. If you must be out, then that would probably be a good idea for you, and I would encourage you to talk with your healthcare provider. We are not discouraging the general public, or we are not encouraging the general public to wear masks, because we obviously are in a shortage of these types of things, and we want to keep them for people that may have the virus that are being evaluated in a healthcare setting, or for those providers that need them as well. If you have concerns or questions that you may need to mask, typically the healthcare providers' offices are identified
technical difficulties. Dr. Segen, if you would continue your final statement about the importance of staying home.
So the question was about the importance of staying home. I'll try to recap again. I will echo what Julie said about the importance of staying home. I know this is a challenging time for everyone, whether you are at home and ill and on isolation, or whether you are at home staying at home to stay well, and we all have anxiety about what the next few weeks bring. We do have control over some things in this situation, and that is how we handle the situation. We understand that there have been reports recently that do show that staying at home does help to flatten the curve and decrease the spread so that we can manage this as a community. I want to encourage you that there are many, many people working on all facets of this to help keep our community as safe as possible, and the instructions that we've given are in order to keep our community as safe as possible. While you're home, it's important that you take care of your mental health. It's important to get outside, get some air, don't congregate in large groups, just with your family, and keep your social distancing in place. It's also important that staying home does not mean that we can't stay connected. We live in an era of technology that is unprecedented. We have phones, we have devices. Please call your friends, stay in touch, nurture and support one another so we can work through this together. But most importantly, stay home. If you are not feeling well, reach out to your provider. We want to take care of you. We care very much about our community and our health care, and we are still open for business to take care. If you are ill, though, I would ask you to call ahead before you come. That way we can all stay as healthy as possible.
Thank you.